Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a new unit, that is the third unit. Here we are going to discuss about what is the importance of communication. As we all know that communication is very important in each and every profession. However, this communication is very important especially for us nurses. So why communication? Here, as we know that nurses are the ones who will be providing care to the patient, who will be supervising the patient. So it is very, very necessary that we must have a good communication skills, because it is through us that the patient will get to express his concerns, and also it is through us that we will be able to take this patient's concern to the ears of the other healthcare professionals. So, in today's topic, we are going to deal with a very, very, very important topic, that is communication. So, this word communication was derived from a Latin word communis, which means common. Why common? Because communication, as I've said, is very important in each and every profession, right? So, that's why this word has been derived from a Latin word communis, which means common. So, what do you mean by communication? Here, communication is the process of transmitting information from one person to the other. It is the process of exchange of any ideas, belief, or thoughts between individuals through a common system of signs, symbols, or behavior. Here, while we are communicating to the other individual, we are passing information. So, this information can either be transmitted through words or through various signs and symbols. So, this is the meaning of communication. So, this is the definition of communication. Now, moving on to the purpose of communication. Why is this communication important, especially in our profession? Here, the first purpose is to collect the assessment data. So here, as we all know that the first and foremost duty of a nurse as soon as the patient comes to the hospital is to collect a detailed history of the patient. So while you are collecting the data of the patient, it is very important that you must communicate with the patient. Why? Because if only a good communication is being maintained, then only you will be getting an accurate data. The next purpose is to initiate the intervention. So here, after the data has been collected, what is the next thing we do? The next thing is we plan for the treatment. So in order to put this treatment into practice, in order to put whatever we have planned into actions, then this must first be communicated to the patient. As I've always said that before you perform any procedure to the patient, you must always explain the procedure as well as the benefit of the procedure for the patient. Here, so it is very important that you must explain the procedures to the patient and to the family members before you initiate any procedures. And the next one is to evaluate the outcome of the intervention. So it is very common that after you have initiated whatever procedure for the client, the next thing what you can do is you can evaluate the whether the procedure has been helpful or not for the client. How can you do this? How can you evaluate? You can only evaluate if you communicate with the client. So by asking questions, by asking how they are feeling now, by asking whether they feel that whatever treatment which has been done for them is effective or not, when we get the answer, then only we can evaluate that the treatment which was given was effective or not. The next is to initiate change which will help in promoting the health. So here, after we have evaluated, if the patient is saying that the treatment is helping them, then we can understand that we can stick through this plan only. But if they say that they don't feel like it's helping, or when we observe the client we see that there's no changes, then through communication we can inform the healthcare professional or the physician who is in charge that you're not feeling that this is helping the client, or that the client is saying that the client is not feeling that there's any change in them. By doing so, we can help to initiate changes which will help them to promote their health. The next purpose of communication is to take measures for preventing any legal problem which is associated with the nursing practice. This communication will also help to analyze the factor which is affecting the health team. So these are the various purposes of communication. Now moving on to the next one, that is the levels of communication. Here we can see that there are 6 levels of communication. The first level is the intrapersonal communication. The next is the interpersonal communication. The third, that is the transpersonal communication. The fourth, that is the extrapersonal communication. Fifth, that is the small group communication. And the last one, that is the public communication. So now let us look at each one of them in detail. So coming to the first one, that is the intrapersonal communication. So here from the name itself, you can understand that this is a type of communication in which the person will be communicating with himself. This can be in the form of self-talk, act of imagination or visualization, or even recalling a memory. So here, as I've said, that intrapersonal communication is a type of communication in which the person will be communicating to himself only. Now moving on to the next one, that is the interpersonal communication. So in intrapersonal communication, the patient will be communicating only with himself, but in interpersonal communication, the patient will be communicating with the another person. Through this communication, the person will be able to exchange his thoughts, ideas, belief to another person. And this exchange of information can either be done verbally or non-verbally. The verbal method is the method whereby one will be communicating through words, that means orally, whereas the non-verbal method is a method where one will be communicating through facial expression, gestures, or body language. So this is what interpersonal communication means. So here, interpersonal communication is a communication in which two people will be communicating, whereby there will be exchange of ideas, thoughts, or beliefs, and this communication can either be done verbally or non-verbally. Now moving on to the next one, that is transpersonal communication. So what is this transpersonal communication? This is the interaction that occurs within a person's spiritual domain. It can be in the form of prayers, meditations, guided reflection, religious rituals, or any other methods in which they will be communicating with their high power. So here, as a nurse, you must make sure that you must first get to know the spiritual belief of a person before you initiate any other further treatment. The person will follow the treatment without getting offended, and that you will be able to meet their needs. Now moving on to the next one, that is the extrapersonal communication. So what do you mean by extrapersonal communication? Extrapersonal communication is a type of communication in which a human being will be interacting with any other species. Usually in a normal communication, a human being will be communicating with the other human being itself. Whereas in this extrapersonal communication, the human being will be communicating with any other species. It can be animals such as dogs or cats, or it can also be plants. So here it is not necessary that these human being can only communicate with animals or plants. It can be many other things, but these things will be a non-human entity. Now moving on to the next one, that is the small group communication. Small group communication is a type of communication or interaction among three or more people who are connected through a common interest, purpose, mutual influence, or a shared identity. This type of communication is usually common between friends or family members. Now moving on to the last one, that is the public communication. Public communication occurs when a person or a group of people gather in order to share an information to the audience or a presentation on any topic which will deliver a message. So as I've said that in small group communication means it'll be a communication only between three or more type of people, that too who are the ones which will be sharing the common purpose or interest. Whereas public communication is a communication whereby you will be communicating with a large number of people, and this communication is usually done whenever any presentation or sharing of information is required on any topic that is meant to deliver a message. So these are the different levels of communication. We have discussed about the 6 levels of communication, that is the intrapersonal communication, interpersonal communication, transpersonal communication, extrapersonal communication, small group communication, and the public communication. Now moving on to the next one, that is the communication process. So this communication process has 5 main components. The first one is the sender, the second is the message, the third is the channel, the fourth is the receiver, and the fifth one is the feedback. So as we know that communication is a two-way process whereby there will be a sender as well as a receiver, which would help us to get a better understanding of what this communication process means. So before you even start the communication, you must make sure that the context of the message must be clear. Why? Because communication is affected by the context in which it takes place. This context can be a physical, social, chronological, or a cultural one. So here, every communication will proceed with a context. So you must make sure that the context of the message should be clear. Now, moving on to the first component of the communication process, that is the sender. So here, who is the sender? The sender is the person who wishes to convey the message or who wishes to start the communication. The sender is also known as the source of communication. The sender is the person who wants to send the message. So before he do so, he must make sure that he make use of all the symbols. It can be in the form of words, it can be in the form of graphics, or also it can be the form of visual aids. So he should make use of all the symbols in order to transmit the message and also to produce the required response. So, as I've said, that the sender is a person who wants to send the message, who wish to convey the message, who wishes to start the conversation. So here, the sender must make sure that he uses all the types of symbols in order to convey the message and also to produce the required response. So now moving on to the next one, that is the message. So what is this message? This message is a key idea that the sender wants to communicate. So whenever the sender writes a message, he should make sure that the objectives must be clearly stated. Why? Because here message is the one which will be transmitted right to the receiver. So it is very important that this message that this message contains all the required information which the sender wants to communicate to the receiver. Transmission of message requires a certain symbol. So here the sender of message must make sure that he or she chooses the appropriate words or the non-verbal technique in order to convert the idea into message. So this process of conversation of the subject matter into symbols is known as encoding. Moving on to the next component, that is the medium. So what is medium? Here medium is the mode which is used in order to transmit or to exchange the message. So here medium can either be in the written form or can either be done orally depending on the number of people that this message has to be communicated. So for example, if anything needs to be communicated to a small group of people, it can be done in a written form. Communication between two individuals, then this can also be done orally. And also, whenever you need to communicate any message to a large group of people, this can also be done orally. For example, providing health education. So whenever you go to a community setting, it is not possible that you provide the same kind of information to each one of the individual. So what we can do is here we can deliver the message. We can choose the medium of communicating orally in order to transmit the same message but to a large group of people. Now moving on to the last component, that is the recipient. So here, who is the recipient? Here the recipient is the person for whom the message is intended, aim or targeted. The recipient is the person for whom the message has been communicated by the sender. So here, after the receiver had received the message from the sender, the next thing he will do is decoding the message. Here, as I've told you, that encoding means conversation of words into symbols, right? But here in decoding, what this receiver will do is he will again convert these signs or symbols in order to get the meaning of the message. So only after the receiver has decoded the message, then only he will be understanding the information of whatever the sender wanted to communicate to him. Here, the receiver's outlook, experience, and attitude plays a vital role in decoding the message. Now, moving on to the last component, that is the feedback. So, what do you mean by feedback? Here, feedback is nothing but the response that the receiver will be giving to the sender. Here, this is very important. Why? Because it will give the sender the idea whether the receiver had really understood the message or not. This will also give an idea to the sender in confirming the correct interpretation of the message. Feedback can be verbally, that is orally, or through non-verbal methods such as, by the facial expression, by their gestures, or it can also be in the written form as well. Feedback is important because this process of communication will never be completed if the feedback is missing. This feedback will also give an idea to the sender whether this message has been received or interpreted in the same way as directed. So we have come to the end of this topic, whereby in today's session we have discussed about communication, the process of communication, the 6 levels of communication, and the communication process. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session whereby we will be discussing about the flow of communication, the types of communication, as well as the various modes of communication. So till then, have a good day. Thank you.